this project that we're doing is looking at the role of a 7T MRI scanner versus a regular kind of 3T MRI in order to image the posterior fossa, which is the back of the brain. And in that region of the brain, houses a lot of key structures, including the cerebellum down to the brainstem, but also a lot of the key lower and cranial nerves. You've got the facial nerve and vestibular nerve, as well as what key vascular structures. So there's many pathologies that can happen in this region of the brain. And regular 3T scans show us some information, but a lot of the time in patients with, for example, vestibular schwannomas, it can lack detail that potentially has the ability to help neurosurgeons with particular operations. So for example, if you've got massive tumour sitting that comes from your vestibular nerve, it's very difficult sometimes to see the course of the facial nerve around that, and a lot of the time intraoperatively, a lot of the time is spent kind of dissecting tumour away from facial nerve. And actually, if we were able to image in greater detail and be able to predict and actually technically see where this nerve is before the operation, it may lead to better outcomes for patients. Damage to the facial nerve can lead to terrible outcomes, such as facial palsies, long-term kind of comorbidities, psychosocial issues. So it's really good that we can explore these types of imaging modalities.
So again, with that, press that in as far as you're comfortable with. Hold it there for a few seconds.
So the MRI scanner itself is a large magnet, and when somebody goes into the MRI scanner, then they become very slightly magnetized, and we can use that magnetic signal to detect changes in tissue composition in the brain. So the difference between an MRI scan and a CT scan is that a CT scan uses X-rays, which is ionizing radiation, which can cause damage to tissue. An MRI scan just uses radio waves, so exactly the same type of waves that you use to pick up Radio 1 or any kind of radio station. And so from that point of view, it's completely safe. The only thing we have to be concerned about is that that the radio waves don't cause warming of the patients, but other than that, it's completely safe.
So I guess the obvious question, Jigi, that comes is that if these scanners, like the one that we're doing in the 70s, the bee's knees, and it shows you way more detail than other things do, and you've got one, like why doesn't every hospital have one?
Yeah, it's a good question. They're very expensive, and also as I previously mentioned, that they do have uneven magnetic field, in the sense that you'll get these areas of signal dropout in the basic image acquisition protocols. You need to really tweak it because it is a lot more sensitive. You really need to tweak it to see what you want to see, if that makes sense. So it's a little bit more complex than that. Also, there's patients and healthy volunteers report kind of physiological issues with the scan. Sometimes they feel, because the field strength is so high, they may feel a bit nauseous, they may feel dizzy, they may be sick. So it has that effect on patients too, and that's something that we need to take into account when running these studies.
The T in an MRI scanner, either 3T for a clinical scanner or 7T for advanced research scanners, the T corresponds to the strength of the scanner, what's known as the magnetic field strength. And so the higher the number, the higher the magnetic field strength. And what that means for us is that the higher the magnetic field strength, then the more signal that we collect. And so we can use that signal to make the images better. And so we can increase the resolution, make the detail of the images higher, or we can make the scans quicker so that the subject doesn't have to be in the scanner for so long.
Patient recruitment is really, really important to us as a group. And that's why we're collaborating so much with the National Brain Appeal, who really do champion the involvement of patients in research.
You've got about 20 centimetres and then you're home.
Kind of helps to bring together a bit more of a community as well, surrounding a disease, for example, and remove some stigma behind that too. So if we can improve recruitment through this type of method, and it's really beneficial for everyone, I think.
Cut.
Bye.